After a mild traumatic brain injury, or mTBI, or also called a concussion, after that's occurred, the first thing that's going to happen is that you're going to have a period of confusion or disorientation. That's usually just going to last for a couple of seconds and at most a couple of minutes. Once that fog or confusion resolves, a couple seconds, a couple minutes after that, then you may actually feel pretty normal, pretty good. Some people have headaches right away. Some people experience dizziness right away. And a very small percentage of people have difficulty right away with just thinking, even being able to speak well or remember things right away. What we will typically see is there's a pretty quick period of recovery after that initial confusion, but then over the next 12 to 48 hours, some of the symptoms, the difficulties I just talked about, start to blossom or come about. So you have the injury, you're confused, you don't know what's going on, and then you kind of come out of it. Again, it could be seconds, could be minutes, and you may be with another football player on the field or with one of your combat buddies. You might be in the emergency department. You kind of know what's going on, you feel good, you go home. But over the next several hours to even days, you may start to notice a number of things. The most common thing is a headache, and that usually gets worse after a couple hours. In most people, it resolves within a couple days, at most 2 weeks. Most people get rapid resolution or improvement of these symptoms, particularly if they start to return to normal activity and doing things. If you sit in bed and don't do much, or you go in a dark room, which is the worst thing you could ever do for yourself, then these symptoms may hang around longer. The second symptom that can occur, may kind of come about after a couple hours, is dizziness. The feeling that you're spinning around, or lightheadedness, or you can't really coordinate your movements so well. It's kind of low level, but then over the next couple hours or even days, it can come about and get worse. It can sometimes be so bad that you feel nauseated, you want to throw up, or you may even throw up and vomit. That's a concern, and you should always make sure you're seeing a professional, a clinician, if you're having this throwing up thing, if you're vomiting or you're feeling nauseated. A couple other things that can occur is some confusion or memory difficulties or disorientation. It might not be there at first, or it may not be there in the emergency department, but again, a couple hours or even days later, you may notice, I seem a little inattentive. I feel a little more forgetful. I can't quite figure out how to get back to my house or how to play that sport, or I just feel like I'm out of it. I'm in a fog. Again, this is something that will resolve with time, will resolve as you return to normal activity, but we're going to see that fogginess or that cloud or confusion resolve relatively rapidly. The last two things that I'll talk about are, number one is a feeling of light being very painful, and you're very sensitive to light, or your sounds are very painful, or you're very sensitive to sounds. The normal way to say it is, man, that light's very sensitive to me, it causes me pain. I have to wear dark glasses, or those sounds are just are bothering me. Those are things we use common sense treatments, as we do for all these things. We put on dark glasses for a brief period of time, for a day or so, or we can put cotton in our ears or wear earplugs if we're very sensitive. Or we're in a darkened room, but we're only doing that just for the first day or so, because we want our brain to get back to normal and our eyes and ears to respond to normalcy. The last thing I'll talk about is one that is a little more subtle, and people kind of sometimes think they're, quote, going crazy, or they don't want to tell people about it. You get very irritable. Things bug you that are around you, whether it's watching this tape of me, or whether it's listening to your spouse or friend or your CO, all right, or it's going to work or having to go to the gym, whatever it is, things that usually you'd kind of be cool with and you take in stride, kind of annoy you, kind of irritate you. You get angry easily, you may scream, yell, you may just want to kind of get away from a situation, all right? And that's normal after an injury to your brain. It's made worse if you got a headache or feel a little dizzy, or your ears are ringing, or your eyes are painful, or you haven't slept well because of all these things. So it's normal. It usually will also recover over a course of weeks. This one comes up a little bit later, may stay around for a little bit longer. It can do very well when you treat those other symptoms we've talked about. When you get to sleeping and your headache feels better, and you're back to normal activity, you're back in the weight room, you're back, with your platoon, whatever you're doing. So these are kind of the top 5 or 6 things that we've talked about, and the typical course of recovery, which in the vast majority of people is absolutely within 2 weeks. And if it's still around for more than a month, you definitely need to be going to see somebody who's specialized and knows how to take care of this, because it shouldn't be hanging around for more than 4 weeks. That's fairly unusual, but that's when you really need the specialist, and that's when we can really help you.